In our last video, we just discussed about what are the latest diagnostic methods of ASD. In this video, we are going to see about what are the latest interventions for the ASD. Applied behavioral analysis therapy. In this, the behavior is analyzed and they are modified. So if the person have the desirable behavior, then it is positively reinforced and the behavior is promoted. If the behavior is undesirable, which means it is unpleasant to the society or to him own, so like biting himself, that like behavior, undesirable behavior or negatively reinforced, or we have to give the punishment to the person and we have to quit the behavior, negative behaviors. For this, we using the psychological behavior modification treatments. So strategies or we are going to use before implementing the applied behavior analysis. We have to take perfect assessment. So in diagnosis, or we have to take perfect assessment for the behavior. Then only we can focus on which part. So in behavior, some parts are fault in the person. So we have to focus on that part, and on that part we have to give reinforcement or we have to use some strategies to modify it. ABA should be started yearly and it should be consistent. Then it give result and it make the person independence and it promotes the quality of the life of the individual with ASD. Okay, second area, social skill training. The person with ASD may lack in social skills. We have to train specific social skills to make the person independent. Social skill training should be conducted in a safe environment. The activity should be structured for the development of the individual and it should be instructed properly. The instruction given to the child should be in a proper manner. So social skills including emotional training, money management like this. Personal things also taught in social skill training including emotional management. Then comes to medical treatment. In medical treatment, the ASD child have some symptoms like behavioral issues, some social skills issues, anxiety issues. So we have to give the symptomatic treatment in the medical treatment because the ASD has no cure. For symptoms, we are giving drug. It reduces the symptoms and it also have some side effects. So we have to notice the side effect and give the drug for the child development. We use anxiolytics, antipsychotics, antidepressants, stimulants like this. In antipsychotics, we use two drugs like risperidone and aripiprazole. So these are all approved by the FDA. Your work is to comment what is FDA. You can do the Google search and comment in our video. So FDA approve these drugs to treat the stereotypic and aggressive behavior of the child. So if the child has more behavior, more aggressive behavior, then we can use the drugs. And selective serotonin reuptake inhibitors, SRI. So these drugs are helpful in antidepressant. So they are antidepressant and anti-anxiety. So they reduce the anxiety and the depression of the person. I already said all pharmacological drugs have side effects. So the prescription should be given on the basis of the side effects and on the basis of that what is needed to the child. Is the drug is 100% needed or not, like this the doctor prescribe the drugs. Then some of the interventions like biofeedback and neuromodulation. So these are all the same methods. So brain going to be modified. Biofeedback, our heart rate and our respiration are controlled by the brain, right? So it should be consciously controlled, then it is called biofeedback. So we have to focus on this area, how my heart beating, how my breathing goes on, like that we have to observe. Then our conscious mind going to change it. Our conscious mind slightly change and our behavioral issues are all going to be fine by the biofeedback method. So our conscious physiological process are controlled. So it improves the concentration, reduce the anxiety, and it promotes stimulation and transcranial direct current stimulation. So these two, magnetic stimulation and direct current stimulation, transcranial. By these two methods, we can modify the brain activity and brain waves. So in this, weak electric current is only used, and it modifies the neural activities, and it helps in the reducing the behavior, and it just slightly reduce the symptoms. Then some emerging interventions, technology assisted. So nowadays we are using smartphone apps, computers, tablet, virtual reality technologies to treat the ASD persons. In virtual reality, the persons are going to be trained in a social skills. So they have a virtual reality. It is not reality. They have a safe environment, but their reality is virtual. And in this, they are training in a social skills. So this is a safe environment, and their social skill is also training, and they can communicate with that environment. So in the virtual reality, the person is come and they going to speak with the person, and the person going to improve the communication skill and improve the social skills. But it is not reality. They are just using the technology to improve their skills. And finally, diet and nutrition interventions. So brain needs some nutrition to develop. So ASD is a neurodevelopmental issues, right? So for the neurodevelopmental, we have to give correct nutrition to the brain. And to reduce the behavioral symptoms, we have to use gluten-free, lactose-free nutrition. So these nutrition helpful in reducing the stereotypical behavior and reducing digestive problem. And some substances like omega-3, vitamins, minerals, particularly magnesium and zinc, are more useful for the brain development. So these should be given to the persons with ASD. So for more information, the nutritional consult should be needed to give a particular nutrition. So these interventions are nowadays emerging. In our next video, we are going to discuss about what are all the researches going on ASD and what are the future researches. So like this, we are going to discuss. So please subscribe our channel, keep motivate and keep support. Thanks for watching. Bye bye.